Hi, today we'd like to talk about uterine fibroids and treatment at Antai Hospital. So uterine fibroids are a benign growth that are found to be growing on your cervix, on the uterus, also on the fallopian tube as well. So many people will be worried that fibroids are actually cancerous or may become cancer in the future, but rest assured, fibroids are not associated with any form of cancer, nor will they ever develop into another form of cancer. Most of the time they are harmless, but depending on where they are growing, they can lead to miscarriages, recurrent miscarriages, and severe ones will lead to infertility. So they are definitely something that we need to actually treat, especially for those couples who are seeking to start a family. So uterine fibroids are commonly occurring in your reproductive years, during your 20s, 30s and 40s. During this stage where most people will begin conceiving, having pregnancies, coincidentally this is the same time when fibroids usually occur. Uterine fibroids are incredibly common, but for those who are seeking pregnancy, it can cause complications, it can affect it. So what exactly causes this is because of the hormonal imbalance that you experience in your 20s, 30s and 40s. During this year, your estrogen and progesterone levels are especially high, which means it signifies that you are very fertile and healthy and ready to begin pregnancy. However, excessively high estrogen and progesterone chronically over long periods of time, then it can lead to these growths of these fibroids, and then the location-wise, it really depends on several other factors. So certain risk factors that we look out for is that you have a family history, you have already other forms of conditions of your uterus, for example PCOS, endometriosis, you may have an increased chance. Another factor is that you have poor diet, stressful lifestyle, excessive drinking, smoking. All of these can increase your chances of this fibroid development. So symptoms include not only the recurrent miscarriage and infertility. Usually you'll experience excessively heavy menstrual bleeding during your periods. You'll also experiencing bloating, some pressure in your lower abdomen, even on your lower back. Sometimes they can also cause constipation and also affect your urination process. Really depends on where they are growing. So fibroids, there are three general locations that they can grow on your uterus. The most outer one is that we know as a subserosal fibroid. They grow towards the outer cavity of the uterus. Intramural fibroids grow within the muscle wall, and they are not to be confused with adenomyomas, which also grow inside the uterine muscle walls. And submucosal ones are the ones that are growing inwards into the uterine cavity, and these are the ones that usually cause miscarriage, infertility, because they affect the endometrial function and also causes incredible difficulty in implantation of embryo. So diagnosis here at Antai Hospital is that we will do a standard blood test to check for any hormonal disorders, thyroid disorders, bleeding disorders, and then we will also need to do a 4D-color Doppler ultrasound imaging to figure out where exactly is the fibroid located. Sometimes we may also use a HSG to diagnose those that are inside the uterine cavity, the submucosal fibroids. So once diagnosed, here at Antai Hospital we offer you highly effective laparoscopic, hysteroscopic surgical removal, also known as myomectomy. So we can guarantee that within 2 years you will not have any recurrence of this fibroid. Now this really depends on expertise and technique, because most doctors, if they remove your fibroid, in a few months you will already see that the fibroid comes back again. Now this is usually due to the technique of the surgery, technique of the surgeon itself. So we can guarantee 2 years. So if you have a history of constant disrupted pregnancy journeys, within these 2 years you can easily have very successful pregnancies and also begin your own family already. Now we cannot guarantee that these fibroids won't recur, but we can at least guarantee that it won't be recurring within 2 years. However, if they do recur, they may also not be related to the initial fibroid. It really depends on your hormonal levels. You also need to bring it down, stabilize with medication that we also do offer here for our patients. We don't do any hysterectomy, which is one of the most general and most common approach for this treatment for uterine fibroids. They believe this is the best method, but we believe this is one of the most destructive invasive approaches of treating fibroids, because you can remove your fertility capabilities indefinitely. It can give you absolute infertility and can cause long-term complications as well. And that's why we at Antai Hospital, with our skill and experience, we do not conduct hysterectomy for fibroids, because it is both unnecessary and destructive. So get in touch with us via the website. Also watch our other videos if you'd like to find out more information about fibroids and how we effectively remove them and ensure you a healthy pregnancy.